Okay, this is a short one. Subject is basically going live, and this is basically just a very short update. Okay, since beginning of middle of October 2018, United Kingdom, this has been where anyone may be offered services by. They call it it's a national sentence advice. I'm sure individuals mean well, but in my area, they have full evidence of first-hand knowledge. All my emails, my friends just helped me find, dated since the second week in October 2018, and all the previous emails that previous public civil servants had corresponded back to me. The evidence I'm going with this is an evidence dated of an email dated Monday the 24th of October 2018. So check if you have any correspondence, your emails as evidence of that. And this is what I've been looking for quite a few days. And later today, I can get that printed out and that will go out as evidence. In United Kingdom, it's known as Department of Works and Pensions Limited. What they've done is contracted out the offer of one of the well-known, if you're disabled, the offer of transition from disability living allowance, used to be known, into statutory law known as personal independence. What I have found out by the evidence and content of the email is this former social worker female called Evie. She was a specialist in her job and she left her job on the 31st of the 10th, 2018. Since then, I've been left without the replacement offer of a public servant. For that subject, for a whole past year, was in conjunction, it's all linked up, in conjunction for any disabled people out there to be offered a national statutory law due process. It's known as the Care Act assessment within the Care Needs Assessment, and the statutory law is the Care Act 2014. It's statutory law. If you want to check it all out on various disability websites, I'll give you a couple I know of. A disability law website, there's disability rights to law website. You can go in and check things out, investigate yourself. I have a background in years in research and media and PR. So if I hadn't dawned on me to check my past emails and find out how to source them with help today, I wouldn't be able to come on with showing my experience only to aid anybody else that might need this key important information. To try and prevent you having to go down this horrendous experience of Ministry of Justice, another national statutory body, organisation of the horrendous experience having to cope with all this months and months and months of delay and loads of paperwork and a lot of situations you may, due to your ill empowerment of health with disabilities, whatever it may be, may not be able to cope with. This deceit is the big issue, where there's non-full disclosure, what should offer, and obviously I know some subjects in contract law. So again, the rejection of an offer, certain well-known, they call themselves a charity, but they are actually set up as a company. So an email will be going out to that individual that has misled me. They already have source of my private life data without disclosing to me. It was deliberately done to mislead me, since that previous email was dated the 10th of the 10th 2018. Previous emails following up to the offer, I alerted them to get assistance because I wasn't getting a correspondence offer at that particular time by a public sector service employee, former social worker in a job. And so they were putting the pressure on me unlawfully to offer various things in my home, knowing full well, which I found the evidence of today in various emails, that I was going to be offered a home visit, and that was meant to be in my private dwelling with the support of this public servant, civil servant, social worker, with another individual. I won't say he, she is, or she's now left a job, so I'm not going to state the company she works for. And I could have by then had this all dealt with and had the assistance of. So if you're in the position that you not have the insight to how your daily life disabilities and what you can and cannot do affects you, and it's very high complex, and you have a lot of medical equipment, and then you have other unseen disabilities, and the cutbacks and services means you're still left waiting on a waiting list to see whether or not you get a care planning or any funding in the statutory services. Well, you can even use that to add to your evidence of how things affect you. So the evidence, the point of this short stream is to alert those that may not be aware to how people can be extremely deceitful. And as soon as you get educated with knowledge of fact, first-hand knowledge, they don't like it. They want to keep you down so you're less empowered and with knowledge to go back with facts, and your rebuttal is very important when there's presumption being made about your character or your personal situation, and these other men and women in their public servant role, and they are public servants, the public pays their wages for whatever capacity or job they work for on behalf, and they're coming to offer a service in your private dwelling, and they haven't divulged and offered the full disclosure of the terms and conditions to your said private dwelling. Anything could happen if you don't set your terms and conditions. And I found these emails, and I had done that, and I had helped to do that, and that's the key evidence I've been looking for quite a while. So when you do a rebuttal to seek clarification on to a public servant, so in this situation it's Department of Works and Pensions, on the subject of the personal independence allowance offer in statutory law, because of my situation, yes, people working can inquire to receive that offer, but they're deliberately nationally failing in all duty of care and breach of a national charter. It's on the website of Department of Works and Pensions. You want to check it out, dated 16th of July 2018, the National Charter. And the key element in this is that I got evidence and factual evidence to co-email a copy of this particular public servant's email to so-called citizens advice at local individual, to inform them there's no way I can do a lot of photocopying, and I don't have the physical health, let alone the energy, which I already done, because they had failed me. I can't count how many emails since last October up until there's a phone call, because I thought, well, hold on, they're deliberately just, not getting back to one on. I had a gut feeling something wasn't quite right, and today I found the solid evidence. I have been unlawfully targeted. They had tried to set me up to fall in the trap of going to all this process of appeal eventually. It's been leading up to that. And if it wasn't for kindness of my friend, as I said in previous stream, I have an hour spare earlier, which is a bit later on this evening. It was, so I'm a bit late coming on the stream and back update, I suppose. And yeah, it's very useful. Got the evidence. That's what you need, is factual evidence, all like black and white paper trail kind of thing, but I've got an email trail. So these dates, the specific dates on the emails and who this individual social worker contacts, a lady called Sonia. She was a Capita employee, Capita Business Services Limited employee, and her job title was nurse assessor, and she was spoken to by the social worker, as I said, on that Monday, the 24th of the 10th, 2018, to state that I was to be offered an afternoon offer medical in my home, the PIT medical, and they failed to honour that offer. So that social worker had got onto the phone for me, and her email that date was at 12:15 p.m. and I've got that evidence of email, and I've got the evidence I need to see for negligence and maladministration. But at the same time, it needs to go using statutory services procedure as well as contract law. So I'm going to try and cover both. And also the next day, absolutely was found that email as well, and that was dated the 25th, on the morning of that individual that cold called up my home without my consent, and didn't know who she was. But this second female, the social worker spoke to on the 25th, the morning of October 2018, was called Maria. She had, that social worker had phoned up and spoke to that woman, and it was claimed this. As that assessor was in the car park, she was witnessed in the car park on a computer straight away, put me down to fail to attend a medical when I didn't even know she was outside. As far as my former social worker and I was concerned, I was going to be offered a date for an afternoon so that civil servant, public individual employee could assist me in my home with another to carry out that medical offer. That was all evidential in the emails and correspondence, which I did not realise I didn't have when I sent my offer to review. So I've got this additional evidence. I can go back to this computerized response of DWP with the printout evidence of that email to confirm I did not attend. I didn't fail to attend because I'm not going, there's no ground that I need to go to that statutory appeal process because I've got this piece of evidence. And hope to goodness the computer don't crash or my internet, but either way, I got my mobile data. I can still send the email, and I think I'll be doing it to, it's known as statutory law, to Head Office, Clacton House, London, the CEO, their complaints department, a copy into that email. Because the contract terms and conditions within the Capita Business Services Limited company is hired and contracted terms and conditions on behalf of the civil servants of the public purse, isn't it? To assess people, and they're just failing people, making it extremely unwell. And you see the statistics nationally on what's happening to so many. So I've just come on to show that I've actually found this evidence, and it's crucial because it does fully exempt me. And although that social worker no longer works in a job, and I'm still waiting on another matter for that, and I found on top of that another email of evidence where I've been failed on a different subject, and that will have to be dealt with another day. But this is very important to the United Kingdom for all those that are struggling to find access to support services, especially when you're bedbound or you're housebound and you've got high complex needs. And it's like they're just absolutely just coming down on those that really do need the support and help. There's not just people, not just my situation, there's so many others out there. And also there's a clause where in the statutory law, Person Independence Regulations 2013, and then you've got the Welfare Reform Statutory Law as well, And there's a key core clause where if you have certain medical conditions, unseen disabilities, and you have evidence of fact, and you send your private documentation off to prove you have ground to be offered a if you can't cope with face-to-face medical, and there's factual evidence to back that up by professionals and documentations and reports or whatever, it doesn't necessarily mean just because it's a certain age group, an age of a report. If that evidence is still relevant to your situation to date, they have a lawful duty of care to take that in consideration and use that evidence. I had also found out they haven't scanned my medical evidence. Capita, business service limited employees, your call centres, you're disgraceful. How can you sit in your job and knowing your computer tapping, your computer system is not even working, your computer software company, you're internationally well known, you have a contract with NHS Digital. NHS Digital is another public funded body. Then you've got another contract with NHS England that looks after, in England itself, all medical contracts, practices, and individuals' medical data. How safe is their data in your computer programs when you even can't get this issue or various issues sorted out, rectified lawfully, and you just hire subcontractors, these men and women class themselves as health and care professionals. So good men and women do have your strengths and do have support around you. Do take it further if you've been failed, because they're bad. The system is unfortunately there to make sure that people are failed and you're less destitute. And this is why they're bringing in all this new, if you have, for example, the offer of employment support allowance subject, and for example, you're in a support group, right? Don't forget that medical evidence in that. They're using the same computer software with Department of Works and Pensions. They're using the same information. And don't forget all United Kingdom statutory services now all interlinked with data sharing. But within the statutory law, the Data Protection Act 2018, you can restrict your sharing of what and even your medical data. You really need to be careful what you're sharing online as well. I haven't made so many streams like this in a period of short time for a while. But as I've got this experience, if I can help somebody else with the factual information, then I will do that. They expect people not, to give up. I'm not like that. I will not just go into a corner and curl up. And yes, you get your good days, your bad days, but excuse me, I don't get led down the garden path that easily. They're counting on people to be in a place of not very good, and get so confused with it all. But when you find out and you've got solid, tangible evidence, these are just men and women in their job, right? And it's the directors, the CEOs of these corporations. They're the men and women held accountable. They're the ones that don't care because they want a good earner per year. It's those that unlawfully, unfortunately, you get ill, it's not your fault. You end up with injuries or disabilities, it's not your fault. You could be born with it. You might have a family with loved ones as well. This is United Kingdom, and this is where if you're working hard, if I had that physical help and ability, do you think I would be doing that by now? Yeah. Because I really do not like the way things are going, not just in my situation, but there are so many good people around the world and different subjects going through a lot more. And I don't use any detrimental, negative kind of comments or things at all. I come on with facts, and that's key. if you can back up information with facts and you can try and do your best. There's no guarantee in anything in life, but be true to yourself, that's all. So they want you to not eat, they want you to not sleep, the stress and all that, because it's profit making, isn't it? You end up going to such a service, your GPs, and more pills. I mean, by the way, be very careful, because all this scaremongering, the Brexit and thing going on in the United Kingdom, the cutbacks and medications, if you're on those, be careful, watch out for any signs of changes in colours or shapes in your normal weekly delivery, or if you get prescriptions. Be careful if you suddenly lose and reduce of your income, because it could affect other circumstances you might be going through. You won't be told a lot of these things because they don't want the public to know. They don't want you have to find these things out. And if you don't have your help, you ain't going to be told these things. You have to do your research. And it's only pure luck I got a PR background of research, and a family member wants me to help her out eventually on her business. But I thought, first of all, I'm going to share what I found out, and I'm going to share the evidence, and I'm going to hold these individuals accountable with the evidence. So I'll repeat, and before I go off on the stream, United Kingdom are deliberately coming after unlawfully a lot of vulnerable disabled people. They're relying on them not well. I can see why a lot of these individuals do not want to whistleblow. A lot of people do. You see, it's not about turning man against each other, man and women against each other, whatever walk of life you're from. It's all about pulling together the public, being aware that these key, well-paid, public-funded, high civil servants in their job roles are absolutely do not give a monkeys. Because whether they're scared or speaking out and they lose their job and their home and their life and family life or whatever, of their so-called security of their income. But what if they end up getting ill? Will they have a private pension or private health care and not have to rely on the state for anything themselves? So beggars to believe, I tell you what's going on. So yeah, I'll just get off now and get some rest and then crack on. One thing at a time with one-off assistance, I hope, to get this document done. Well, it would be the emails first. Bombarding lawfully and honourably. You've got to be careful, obviously, how you word your correspondence and when you're copying in. So as soon as I copy that certain email of evidence into another individual tomorrow who represents another corporation, that will soon let them realise that I know the game, what they've been playing me unlawfully, and they will not be getting away with it. So I shall counterclaim and seek clarification and cease and desist from the lawful to scrap. It's like a character assassination attempt to discredit the individuals that it's like, unless you do the full rebuttal of assumption one had not done something by a public body representing, especially in this situation, you need to rebut assumption. So say in your personal life, say a friend or family member says something about you, or that's not factual, and they won't let it go. You have to walk away sometimes, whether it's a family or friend. But when you're dealing with civil servants, you need to have, they keep record, they keep computer records, you need to do the same. It's paper trail. I've learnt that one a long time ago, but the evidence is what you need. So if you're not very good on paperwork and you haven't got that, and you haven't got finance for papers and printing and ink because of what they negligence have caused you, and the loss of ability to fund your extra costs and your disabilities, that's what it's there for, isn't it? That's what it's meant to be there for. So in my opinion anyway. There's very helpful information out there, free information to download. And if you're using Facebook, I don't like it myself, but if you're using social media websites, just source out what information you can, why you can, while you're able to still perhaps afford your internet. Because so many people are going downhill very quickly. And especially with the universal credit, that needs to be scrapped altogether. You see, when you start learning the truth about a lot of subjects about monetary system and how there's a darker side to a lot of things, I won't go into all that myself. I'm not here to do that. I'll let other people to explain a lot of factual evidence of what's going on for a long time. I've known a lot of things for years, but I just got to focus on one thing at a time. So take care. I need to go. I need to get rest. I need to focus and have get on board with this. As they say, time's at the essence. Tomorrow's another day, or later today in UK time. Whatever you're watching this, wherever you are in the world, be aware. Whatever you hear about mainstream media in the United Kingdom or people in my situation is always usually one-sided. The narratives, the so-called mainstream media, you know, when you learn out who you really are, your man, your woman, individual, the power you hold within, you get your good days, your bad days, you know, that's life, isn't it? So take care. And I just come on to say, well, when I'm able to, when I've got the things done I need to do, then have a better day, perhaps at the end of the week, for me at the weekend in UK time. And I'll quote the actual evidence I've got, but it needs to go off first to individuals, and I won't show the identifiable information, obviously, but I will quote the words that were said. So yes, Capita Business Services Limited head office is a corporation in London. They have call centres and Darlington, I think it's called. And it's obvious that you've been using computer systems and haven't followed their own due process. And so it is going to be hard to get a remedy, because they will not going to admit to their mistakes, will they? You see what they do with people when they go to Ministry of Justice, tribunal system and statutory law. They go through so much. You take care. God bless. I've got to go. Sign out.